folks that are still standing, if they can try to get to their seats as quickly as possible. Senator Murphy is here, and I'm honored and excited to welcome Senator Chris Murphy to the NAMI State Conference. Senator Murphy has shown great passion and knowledge about access to quality health care and challenges associated with that. He started this path as a Connecticut state senator and is now appropriately serving as on the powerful U.S. Senate Health, Education, Labor, and Pensions Committee. We look forward to Senator Murphy sharing some updates on what is happening in Congress, and he's also very interested to take your questions. So without further ado, I'm going to introduce Senator Chris Murphy.
Well, thank you very much, Kate, and I want to thank everyone for taking a beautiful Saturday when you could be out raking your leaves or doing your fall cleanup and being here to essentially re-energize yourself and the community that cares so deeply about the issues surrounding mental illness and mental health. My name is Chris Murphy. For those of you that I don't know, I am in my 9th month now as the new United States Senator from Connecticut. I served before that for about 6 years in the House of Representatives, and before that was in the state legislature in Connecticut, where I had the opportunity to chair the Health Committee as well in Hartford. I very often simply say that I come from a family with a very proud history of mental illness. And I say that because we're not ashamed of the fact that we've struggled with mental illness just like we've struggled with all sorts of physical ailments as well. And we've had our ups and our downs, and mostly ups, in part because we know, as you know, that as long as you have the resources, as long as you have the ability to go out and find treatment and find medication, then you can be just as well as people who have conquered physical ailments as well. And I've dedicated a large part of my career to trying to make that reality, which my family has had access to, the reality for all sorts of families who don't. First bill that I wrote when I got to the United States Congress in 2007 was the Frank Melville Supportive Housing Investment Act, which I named after Frank Melville, as many of you know. That bill tripled the number of supportive housing units that we build with federal dollars, not by increasing the amount of money, but simply by making more efficient use of those dollars. So you partner federal dollars with private dollars and state dollars and reward private developers who are going to build some supportive housing units amidst their larger private developments. And so I'm here today just really excited to see such a huge crowd here and want to make sure there's time to answer some of your questions about everything and anything happening in Washington related to the field. But I want to maybe run through very quickly 4 topics that maybe aren't going to be the subject of a panel or a speech today, but are things related to things happening at the federal level that I hope you pay attention to. So let me run through the 4, and then let me just open this up to questions that you may have. We are going to have a conversation about entitlement reform. That means the reform of Social Security and Medicare and Medicaid. And the question is, how are we going to reduce the amount of money that we're spending, at least on a growth basis, in Medicare and Medicaid? Because if we don't, then those programs just aren't going to be around in the same shape or form as they are today for me and for my kids. The big win here is to do something called delivery system reform, to effectively change the way that we pay for healthcare away from a model that basically rewards volume, the amount of medicine that's practiced, and instead a model that rewards outcomes, how healthy you're actually keeping your population. Effectively flipping reimbursement on its head to say we're not going to actually reward sickness any longer, which is what we do today. Hospitals make money the more people they have in the hospital, and instead say hospitals are going to make money the less people you have in the hospital. It makes a lot of sense. It's a simple concept, and it saves more money than you can ever save simply by raising the retirement age or increasing the taxes that go into Medicare. A new report by the Bipartisan Policy Center, a group that involves Republicans and Democrats in Washington, says that you can save almost $600 billion by a series of pretty simple delivery system reforms. Why does it matter to all of us who care so deeply about mental health coverage? Well, the reality is that outpatient mental health care doesn't make any money for hospitals. It should, but on current reimbursement models, right now there's just no financial incentive for hospitals to do that kind of work. There is a financial incentive to invest in inpatient care because that can give you a little bit more of margin. The biggest incentive, though, is to invest in procedures. That's where hospitals make money. They make money in procedures. Well, we don't do a lot of procedures when it comes to mental health care. That's not where our healthcare delivery system model is. And so if you change the whole way that we reimburse healthcare and say we're no longer going to just provide you rewards for sick care, which is basically rewards for lots of procedures, and instead we're going to give you an amount of money that rewards you for keeping people out of the hospital, then we're going to actually incentivize care for mental health, because